Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to be going over how to handle failing a test in nursing school. When you fail a test in nursing school, it can be really hard to deal with emotionally because you have a lot riding on how you perform on exams. For instance, you have to score certain grades in classes in order to stay in the nursing program. Or if you're getting scholarships or financial aid, you have to have certain grade point averages. So when you fail an exam, it is stressful. Now, from being a previous nursing student myself, I have performed poorly on some exams, and whenever I did, I got upset, I cried, and I was really stressed. But the key is you have to recover quickly, and you just have to recognize what you got to do to perform well on those next exams. So if this has happened to you, let me just tell you, it happens to all of us. Every nursing student, at least one time during their nursing school career, is going to perform bad on a test. It just happens. But what you need to do is get down about it. Go that day you find out you failed a test, go home, eat your favorite meal, go do something that's fun and relaxing. Take the whole day off if you can and watch TV or something. And the next day, pick yourself up and recover and develop a plan on what you can do to pass that next exam. Now that's what this video is about. I want to give you some tips on what you can do if you have failed an exam to help pick yourself up and get ready for that next exam so you can pass this class, get through nursing school, and become a nurse. So let's get started. Okay, the first thing you want to do whenever you get that test grade, you know, passing out the papers, or you see it on Blackboard or D2L or anything like that, and you see your grade, it's like, oh no. You need to look and see how everyone else performed, because chances are if you perform poorly, other people have performed poorly as well. And then you need to try to find out people who performed really well, because you know in nursing school everyone's telling everyone so-and-so scored this, so-and-so scored that, or you guys are sharing what you scored. That's how it was in nursing school. We're always telling each other how we done. So you need to find those high performers, especially if this is the first test, and see how those people prepared. Just ask them questions and say, okay, how did you study? How often did you study? What material did you study? Even ask them if you could see their notes and see how they take notes, what material they jot down that's important. Next, even take it a step further and ask them if they would be interested in forming a study group where they could maybe be the leader of the study group and help you guys focus on what's important to study. This really helps. In nursing school, we did this. We would find the people who performed the best. Some people aren't interested in doing this, but some are. They're more than happy to help. But always make sure of that and just ask them, and that really helps because a lot of people, they give you tips and tricks on how to study. Okay, next, ask about extra credit opportunities or a retake. And this is really important, especially if lots of other people perform poorly. Now, this is totally dependent on your professor. Some professors are open to this, some are not. But if a lot of you students have failed the exam together, you can go to the professor together, maybe ask for an appointment to see them, and have a group of people go with you and talk with the teacher. That lets them know that, hey, maybe they didn't understand this material this well. For some reason, they didn't grasp it. Maybe I should give them some extra credit opportunities, or maybe I'll develop a new test and give them a retake opportunity. And this happened in nursing school several times. All you have to do is approach these teachers, these professors, and a lot of them will work with you and help you. So look into that. Okay, next, ask your professor for advice. Now, say that everyone else did good, you didn't do good. Ask your professor, make an appointment, and talk with them and see what you can do to perform better on the test. A lot of times they will get your exam out. They'll go over the exam with you and help you learn how to answer their questions, because some professors have certain styles on how they present their questions, and they'll go over them with you. I had a lot of professors who were like that. They were more than willing to help you out. And a lot of times these professors can help point you in the direction of maybe some study guides to study for those specific classes, which I'll go over here in a second. What are great to help them, because maybe sometimes they take some material out of that to form their questions. And also, sometimes they know students who've already passed their classes who are willing to tutor you or ask for advice. So always go to the professor if you can, if they're approachable, and get some advice with that. Okay, my next thing is get a tutor. Whenever I was in nursing school, a lot of programs, they have what's called the LRC, the Learning Resource Center, and they offer free tutoring. And usually these tutors are students who are volunteering their time to teach other classes that they've already passed in the program. And this was great. One class that I really had issues with in nursing school was pathophysiology. It was a difficult class, but our Learning Resource Center had free tutoring services for us, and a student would come in on certain days of the week and she would teach us the patho, and she's already taken that class with that teacher, and she would help guide us in the material we need to study, what that teacher would hit on in the exams, and it really helped. And if you don't have that, maybe you want to look in forming something like that because it's super helpful. And of course, some universities have where you can pay for tutors or things like that, but free is always better. Okay, next, increase your study time and invest in a study guide. Okay, if you have failed a test and the teacher's not going to give any extra credit opportunities or let you retake, you need to just look and say, okay, I failed this class, next exam I'm going to do better. So you need to focus your time on that class specifically. And all your other classes that are just a little bit easier, set them aside, don't focus on them as much, and ramp it up and how much you're going to study for this class. In the previous videos, I talked about how to develop a study schedule with your planner and things like that. So you want to make sure that you're going to invest time in this class and evaluate how you prepared for that previous exam. Ask yourself, did I really study as much as I should have for this exam? Did I notice while I was studying I just felt like I couldn't absorb all this material? Did you have a lot going on that week? Maybe you had to work. If you're working, you had to pick up an extra shift, or you just worked too much. Maybe you got sick and you were tired, the kids got sick. Or you had a project you're working on in another class and didn't think this class was going to be too hard. So just juggle and switch around your classes and how you study so you can invest more time. Because usually that's what's happened why students failed an exam. They really didn't dedicate that much time studying and what they should have. And then the next point, if you have failed the exam, usually the first or second exam, and you're not doing well, and you haven't purchased a study guide that goes along with that specific class, I highly recommend that. And I talk about this in my How to Study for Medical Surgical, How to Study for Pharmacology, and How to Study for Nursing Fundamentals. There are specific study guides made just for these classes, and I recommend the Mary Ann Hogan series. They go along specifically with these nursing classes. It breaks down the material, pretty much the test material that professors usually test you on. It has practice questions to practice at the end, and it is great. Like for medical surgical nursing and pharmacology and those classes, I really could not have made it through those classes without those Mary Hogan books. So I really recommend, don't have study guide, you failed the test, get one of those. Okay, and then the last option, and I put this last because this is the last resort. If possible, you see you're failing the class, you failed some tests, there's really no way you've calculated, there's no way you're even going to pass the class. Look at withdrawing from the class, because usually, depending on your university's policies, you can only withdraw within a certain amount of time, and you'll need to look and see if it affects you being in the nursing program. Talk with an advisor. Advisor will help you with this, because it usually looks better to have a W in a class that you withdrawed than an F, and then retake the class in the summer or during the winter break, because a lot of schools now during that December time, they offer the class online and they allow you to take it during the winter break. So look at your options, but that is the last resort. Okay, so if you have failed an exam, I'm here to tell you it happens to all of us. Nursing students and nurses, we've all failed. So pick yourself up, try to take these options, increase your study time, and know that you can get through this. And thank you so much for watching, and please consider subscribing to this YouTube channel.